Okay, hi. So this is the extract DVD 1, which this information is obtained from source, a textbook of clinical pharmacology and therapeutics, 5th edition. So what is the topic or the content that we will cover is all of this. So and in the bracket is the page of this topic or the content obtained from the source. So let's start with the first one, volume overload. So we have to study the factors. So the factors of volume overload is the excess sodium chloride and also water in our body. So what are the treatments? Include we have to treat the underlying cause and to reduce salt intakes, as well as we can use diuretics to eliminate sodium, because in diuretics, so we can see here, it increases urine production as well as the sodium ion excretion. So what are the uses of diuretics? Okay, we can use diuretics in managing hypertension, disease associated with edema, as well as when the condition of volume overload, as we said just now here. So the examples of the disease including the heart failure, cirrhosis, renal failure, and also nephrotic syndrome, which we will talk about this after that. And also diuretics can use to reduce plasma volume. So next is the cirrhosis. It is the fluid retention, is also called as ascites. So the factors causing ascites in a cirrhosis is the portal hypertension leading to loss of fluid into peritoneal cavity, and also the hypoalbuminemia, and also the hyperaldosteronism. So what are the treatments? Including transplantation, symptomatic treatments, diets, and also drugs. So for transplant, we have to ensure if the underlying pathology is cured, then only we will carry out the transplantation. And also, if the event will not occur again in the donor liver, then only we will do the transplantation in the patient of cirrhosis. And then for diets, is the less protein in hepatic encephalopathy, and also we have to restrict the salt intake as well as a moderate water restriction. And both of these is monitored. We can use the monitor of daily weighing to ensure to achieve our goals in controlling the salt restriction and also water intake for cirrhosis conditions. And the fourth one is the use of drugs. So we can use potassium sparing diuretics. Example includes amiloride and spironolactone. But we will not use thiazide diuretics and also loop diuretics. This is because these drugs will exacerbate potassium depletion, because they will remove or increase the excretion of potassium. But for the potassium sparing diuretics, they will increase the potassium level in our blood. So next, continue to the next. So is nephrotic syndromes. First one is the impairment of barrier function of glomerular membranes. So the nephrotic system is the impairment of barrier functions of glomerular membranes. This will cause the leakage of plasma albumin into the urine and cause low plasma albumin. So what's wrong with it? When the plasma albumin concentration falls, water will pass from the circulation into the tissue spaces, and this condition is called edema. So when edema occurs, it will cause drop in our blood volume. So decrease in blood volume will cause stimulation of RAA system. This is the renin, angiotensin, aldosterone system, which will help to retain the sodium and also retain the water in our body to increase the blood pressure. So about nephrotic syndrome also, the high albumin concentration in tubular fluid contributes to the resistance to diuretics that accompanies nephrotic syndromes. And also protein binding of such diuretics within the tubular lumens therefore reduce the concentration of free drugs, which is the active drugs in tubular fluid in contact with the ion transporters on which they act. Next is about heart failure. Heart failure, we can have two management. One is for chronic heart failure and another one is acute heart failure. So let's see chronic heart failure. We have to control, the aim is to control symptomatic edema and also dyspnea. Okay? In mild case, we can use diazides and loop diuretics in combination. And if so, another drugs that we can use is spironolactone, which helps to improve survival in patients with cardiac failure and counters diuretics-induced hypokalemia. So we have notes here. Diuretics-induced hypokalemia increases the toxicity of digoxin. So we have to be careful also. And for spironolactone, it will cause adverse effect, which is severe hyperkalemia. This is because spironolactone is under the types of potassium-sparing diuretics, so it will increase the potassium level in our blood. So we have to always monitor the plasma potassium ions level. Continue to the next is the hypertension. So for the first choice drug is the low dose thiazide, which is given orally. And then for essential hypertension, especially low renin as essential hypertension, we can use spironolactone and eplerenone. And for more severe cases, we use thiazide combined with other drugs. And we can also use loop diuretics. It's in a hypertensive patient with moderate or severe renal impairment, and also the patient with hypertensive heart failure. And this will help to reduce the risk of stroke. So continue, the next one is the angiotensin converting enzyme inhibitors. And the uses includes for hypertensive patients with complications such as heart failure and myocardial infarctions. And also, it also used for antihypertensives in diabetic patients. So the using of ACE inhibitors before the first dose, we have to stop diuretics 1 or 2 days before. This is because both of these drugs, if combined in very near durations, it will cause first dose hypotension. And next is the NSAIDs, whereas NSAID consequently cause salt and water retention. And this antagonize the effects of diuretics, which will exacerbate heart failure. And next, the NSAIDs reduce lithium ion clearance and plasma concentration of lithium. And also, NSAIDs increase plasma potassium ion concentration. We move to the potassium sparing, where potassium sparing inhibits distal sodium ion and the potassium ion tubular exchange, which causing potassium retentions. There's two types of potassium sparing diuretics, which are the competitive antagonists and also the sodium ion potassium ion exchange antagonists. The examples include spironolactone and everinones, which the spironolactones in high dose will cause the side effect gynecomastia, breast tenderness in men, and also menstrual irregularity in women, while for eplerenone is more selective and lack of these estrogenic effects. So the examples of the sodium ion potassium ion exchange antagonists are the aminoride and also triamterene. Move further on to the elderly patients. There are some adverse effects always accompanied, such as postural hypotension, glucose intolerance, and also electrolyte disturbance in elderly patients. And then they will also cause urinary retention with the use of vigorous diuretics. And sometimes the use of brisk diuretics will also cause incontinence. The use is to use in the patient with mental impairment and also the patient who reduce mobility to help them to remove the urine. And there is 4 uses of diuretics in elderly patients, which is the thiazide diuretics and also loop diuretics. Loop diuretics is used for acute heart failure and also maintenance treatment of chronic heart failure. So we have to always monitor plasma potassium level. If too low of plasma potassium level, we can add the use of potassium sparing diuretics, while if too high, it will cause hypokalemia. So the last one is weight loss. Diuretics cause a transient loss of weight through the fluid loss. So the use of diuretics in weight loss is still being studied. So this is all of the summary for extra activity 1. Thank you for hearing. Bye.